Hello, my name is Elizabeth and I'm one of the 3 hygienists in Dr. Alexander's office. Many of our patients ask questions about snoring. Today, I am joined by Dr. Alexander. So let's get started. Dr. Alexander, why do people snore?
Elizabeth, that's a great question. When you are sleeping and you have difficulty moving air through your nose and throat, it causes the soft tissue in the back of your throat to vibrate, thus snoring.
Can snoring be a sign of an underlying health issue?
Snoring and sleep apnea are linked at an alarming rate. 1 in 3 men and 1 in 5 women that snore have sleep apnea. Sleep apnea prevents healthy sleep and has been linked to health issues such as hypertension, heart disease, obesity, and type 2 diabetes.
Can we test a patient to see if these issues are present?
There are 2 tests that we can do. There is a screen that's non-invasive that we do in the office to tell us how much a person's airway collapses. And then if we notice that it does collapse quite a bit, then we recommend a sleep test, and we can discuss the sleep test with the patient.
Does dental insurance pay for snoring treatment?
You know, unfortunately, dental insurance does not. The reason it does not is because this is considered a medical issue, and thus the patient's medical insurance will cover snoring treatment.
This is Elizabeth and Dr. Alexander reminding you,
Smiling is contagious.